Hello, hello. Welcome back, everybody. Welcome back to the CAT Scan Guru podcast. Happy New Year, everybody. We are in 2026. This is fucking amazing and it's fucking exciting. I am so grateful and thankful to be doing podcast episodes again. Took a little break to kind of get myself in the groove. Lots of good stuff coming for the podcast. So I'm going to give you a rundown before we get into today's episodes. So this is season 3 of the CAT Scan Guru podcast. This podcast has been going for 3 seasons, 3 years, and I'm super proud of that. So thank you to everybody who makes this podcast show possible and continues to listen, subscribes. You guys are fucking amazing because it keeps me just inspired to continue to put this content out. So let me kind of give you a rundown of what things are coming to the CAT Scan Guru podcast. So lots of good topics are coming to the podcast show. So we're going to be talking about different different types of episodes and topics when it comes to making sure that your CT training is tip top, what you need to know as a beginner, workflows, and things that you should know so you don't feel lost in your first year of CT. And I'm also going to go ahead and give some really good tips and things like that, whether you're a new technologist, old technologist, experienced, whatever the case is. And that should be, it tailors to the masses there. Also, lots of good things coming for the YouTube channel, a lot more educational videos. So make sure you subscribe to the YouTube channel. It's linked in the show notes. So make sure you guys check that out. Been diving deep into getting those educational materials. And you will also see a playlist of all the protocol videos. If you follow me on TikTok, all the protocol videos that I do, it is now available to you on the YouTube channel. So make sure you go check that out and subscribe. Okay. Also, I have a very exciting venture that I took place in, and this has become a good reality. And I've been working on this all year in 2025. So now it is available to all you technologists out there. I have created probably the first of its kind, I believe, of a CT protocol book. So the essentials, it's a basic general protocol book that is available for purchase. You can either download it as a PDF or purchase it as a hard copy. This has been requested, I don't know how many times, through DMs, emails, comments on social media, things like that. Got my little brain together, all the protocols I've used throughout the 23 years I've been a technologist, and got some general perspectives together, visuals, you name it, sections where you can write notes to help guide you in your CT training. So that is a CT Essentials protocol book. So make sure you check out the show notes. I'm super excited about this. So it is one thing that I've been working on all in 2025. I know I kind of led up to it, kind of mentioning things here and there. I just didn't want to give away too much information just yet until that book was live. So make sure you go check it out. I think it'll be very, very helpful, especially the oncoming new technologists or even you seasoned technologists if you need a little bit of extra refresher. So that is one of the things that's very exciting, and hopefully that will channel the masses, and hopefully I can get it into some of these CT programs to help them out too. So go check that out. Everything is in the show notes. Make sure you follow on TikTok or Instagram. Subscribe to the podcast, subscribe to the YouTube channel, all good things coming. So let's get into today's episode. So in today's episode, we are going to be talking about why, as a new CT technologist, they feel lost in their first year. Okay. I was a new CT technologist at one time, and I could tell you in the very beginning, I was very overwhelmed, and it was a lot when it came to CT. And I felt fucking lost in my first year as a scanning CT technologist. Now, there are several things, and I'm going to just kind of give you some of the topics that I'm going to talk about. There are several things why this happens. Number one, there's training gaps. It's an emotional toll that new technologists feel. And we really don't know as a new technologist what we actually need. So I'm going to be diving deep into these topics. So the first thing that I talked about was training gaps. I see this everywhere I go. There are a lot of training gaps when it comes to people who are coming into CT for the very first time. And they're learning because they want to gain the experience. They want to transition to CT. Students from CT programs, I've seen it all. And I think I know exactly why this happens. So a lot of the reasons why we have training gaps is because there really isn't a system that is in place in the clinical setting, like out there in the department. We're not talking about CT programs. We're not talking about any of that. Okay. So that is separate from this. We're talking about you as a technologist coming into the department, whether you're transitioning from x-ray, whether you are doing your clinicals from a CT program, okay, even though, CT programs really don't have like a structured, training program in the clinical setting. Sorry, but I haven't seen one. So unless you guys have, you can let me know. Or if you're even a traveler and you're coming onto a new site, you have to be properly trained on exactly how exams are done, what the policy and procedures are. We really shouldn't be teaching you how to scan because you should know that. Now, the things that we should be teaching you is this a CT machine that you've used, and making sure that you know how to use it, because everybody's scanning ability should be the same, okay? So lots of training gaps where I haven't seen like a very just solid system, training checklist, or even a training program really that exists in a lot of these facilities, hospitals, clinics, wherever it is that you work at. Okay. And I think this is a huge disservice and a huge disadvantage when it comes to new CT technologists, because that is the piece that is missing. Because CT is overwhelming. It's very complex. There's a lot of freaking protocols to remember, and contrast, patient centering, and all these things that you have to know. So if we set up our techs for success, where we set them up that they have a proper system, checklist, a proper training program, this will alleviate a lot of the burden and a lot of the frustration that a lot of new technologists really feel. And I think it's a really good thing. I know at the facility I work at, we started implementing a training program when people come on with the checklist. I think it could be solidified a little bit more, but I am not in charge of that program. But a clear system with a checklist, with a clear training program, and just step by step on how it should be devised is very, very important. If you want more on how I feel this should be structured, I have a free PDF guide in the show notes that you can check out. Now, the second piece to this is the emotional toll. We know that from 15, 20 years ago to now, the amount of imaging that is ordered has just quadrupled. We can just 1000% agree on that, okay? Because the amount of imaging that comes out of emergency rooms, that comes from outpatient, that comes from inpatient orders is a lot. And the thing is that when you have your work list and you have 20, 30 CTs that you have to do on 20, 30 ER patients, and then you have 7, 8, 9, 10 stats from the ICU, you have excuse me, a outpatient list that is 60, 70, 80 patients long. And that's not including anything that gets added on. Okay. It can really take an emotional toll because turnaround times are a huge thing. And it's a lot of what management and hospital administrations are pushing out. Okay. That pressure is felt in the emergency room and it's felt in CT departments. Basically all of radiology as well, right? So the emotional toll is, okay, there's 20 stats. We got to get these done. They have a criteria of our turnaround times. And because behind those turnaround times, the hospital gets a certain amount of reimbursement. And that's why they stress turnaround times and this and that. And it's very emotionally taxing and very frustrating. So my advice to you as far as that is don't try to take on so many exams at once. You can only scan one patient at a time. That's all you can do is one patient at a time, right? So what I highly encourage you to do is make sure that you focus on the patient that you're scanning and make sure that you are very detailed. Don't try to rush the process because that's how we make mistakes. Focus on that patient, focus on that exam, make sure you do it efficiently, safely, and then we get everything done, recons, the whole 9 yards, and then we get the patient back to the ER so we can move on to the next patient, okay? Because CT is very emotionally taxing and you can feel very rushed. I don't want you to feel rushed because that's how you make mistakes. That's how patients get injured, And that's how serious sentinel events come about. Okay. What new technologists really actually need? They need support. This is a big one, guys. Support is very, very important. Okay. When it comes to who the preceptor is, who's training you, who you're picking up knowledge from, who you're asking questions to, emotional support is very, very important. Okay. And you have to have that accountability as well and constructive feedback. Because if you're messing up on exams, you need to know why and how to correct them the first time. Okay. The thing is what I absolutely despise is when new techs are paired up with seasoned people who don't know the why behind things. You have to know the why behind things. Do not train people to be button pushers, because that's not what we are. We have a very important job. We are a profession, and we take care of patients just like nurses would, respiratory therapists, doctors, residents, whoever's in the hospital that touches that patient. Okay. So what they actually need is emotional support, because some exams, you know what? It does something to us, especially if the patient codes, we're doing CPR, and the patient happens to not be with us anymore. That can be a very big emotional toll on us. Okay. And that emotional support is very, very important, especially because as healthcare workers, we see a lot of things that the general public does not see and that nobody should see. That constructive feedback is very important, because if you happen to screw up on an exam, you have to know why and how to correct it. Or if you get stuck somewhere, you have to know, hey, this is where I'm stuck. I need help. So you need to have a strong preceptor. That is what new techs actually need, a strong preceptor, somebody that they can ask questions, somebody says, okay, I don't understand this. Can you explain this to me? Can you show me how to do this? That is one of the most critical pieces that we need to instill and make sure that we practice every single day. And also, do not gatekeep. Okay? I don't know why some technologists like to gatekeep. Do not gatekeep. Because you know what? Me as a preceptor, or me that's teaching somebody, I would want the person who I'm training or who I'm educating to know more than I do, because then you know you've done your job. Even from very old school technologists, techs that have been in the business 35, 40 years, I enjoy having conversations with them because they have a lot of knowledge and you can learn something from them. Even some of the new techs, if they picked up something, you could still learn from everybody. And that is something that new technologists really need. You need to have all those pieces, because that is very good for your toolbox of knowledge. Okay. And also write things down. Protocols, incrementations, positioning, supplies that are used, contrast amounts, pediatric protocol, whatever the case is, make sure you carry a notebook and write them down. And I'm going to tell you why. Your brain cannot handle the amount of information that CT pumps out. There is no fucking way that you are going to remember all those protocols and all this and all that. It's physically and mentally impossible. That's why I encourage everybody, or even make some notes on your phone, voice notes. I don't care what it is. Just make sure that you write something down and make sure that you keep it stored somewhere, that if you have to refer back to it, that's what you need to do. Notes on your phone, voice notes, whatever it is that will make you remember, okay, this is what I need to do in the event of this. These are the supplies I need for a biopsy. This is what I need for a cardiac exam. Whatever the case is, just make sure that happens, okay? So you need to learn structured CT training. I have a course linked in the show notes that you can go ahead and follow, and that you can get just some structured CT training, okay? So that is it for this episode. And hopefully all these points that I went ahead and addressed will help you while you're training on the floor and making sure that your CT training is efficiently. And hopefully your first year in CT doesn't feel as dreadful or lost or overwhelming after some of these tips, okay? So everything is in the show notes. Make sure you give me a follow on TikTok, on Instagram, subscribe to the podcast, subscribe to the YouTube channel, all good resources to keep your CT training tip top. So thank you so much for joining me in this episode, and I'll catch you guys on the next episode.